Okay, good afternoon, everyone. Thank you for joining us for for our session 6 of the student mental health. We're going to be covering mental health considerations for schools, and just a few housekeeping pieces I'm going to talk through, but before I pass it over to Stephanie to do her presentation. I'll be muting folks as they get in to try to cut down on the background noise. And we will be using the chat feature in Microsoft Teams if you have any questions you want to ask during the presentation. Just a quick thank you to our past presenters as well as our current and future ones. Folks have taken a lot of time to prepare an excellent presentation. I think y'all will really enjoy it. Just quickly to kind of recap some of the past sessions. Each session, including this one, has been recorded. And we have a bunch of great topics. We have today's mental health considerations by Stephanie Peterson, and then we have one more set for August 5th, which is tackling the unfunded mandate of expanding reimbursement for mental health services in schools by Dr. Melinda Hollinshead and Jessica Rod. I'm going to go ahead and turn this over to Rick to say a few words and kind of introduce our speaker today.
Thank you, Kyle. Good afternoon, everyone. It gives me a great honor and privilege to introduce Ms. Stephanie Peterson, our speaker this afternoon. Stephanie is a licensed professional counselor who earned her Master of Arts degree at St. Mary's University in San Antonio, Texas. She has extensive clinical experience working with various populations, including kids, adolescents, families, and adults in a variety of settings. Stephanie has a passion for sharing her expertise through training and speaking on topics related to children's mental health. She has provided these trainings for school district staff, law enforcement, military personnel, parents, professionals, and students. She is currently at Texas State University in the Texas School Safety Center and serves as their mental health subject matter expert training specialist. Please join me with a hi in the chat box to Miss Stephanie Peterson. Thank you, Stephanie.
Thank you. Happy to be here today to speak with you about mental health considerations for schools. The information I'm providing today contains an overview of various mental health topics, and we do plan to update our website soon with these additional information. Think about this. We're living in a time in history where COVID-19 has impacted nearly every country in the world. We're encountering situations and changes like we've never seen before, and we're navigating these changes in a time where no one knows how this is all going to play out. And it feels like just when we're beginning to get our footing, things change. The pandemic and the consequences of it has impacted people's mental health. And although we don't know how long this is going to last or how long it's going to affect people, we do know that it has impacted people's mental health. And whether education takes place in the fall on campus or through remote instruction or through a mixture of both, what can we expect and plan for to best support the mental health of students and staff as they return to school in the fall? What I'll be talking about today is how mental health has been impacted by the COVID-19 pandemic and how school staff can best support the mental health of students and staff in the transition back to school. As I talk about these things, think about how they can apply either to in-person or remote instruction. I will be talking primarily as those students are returning on campus, but these ideas can be translated to remote instruction. The COVID-19 pandemic brought unprecedented change to schools and has significantly impacted children, their families, and school staff. Awareness of what children have been exposed to affords schools the ability to be proactive in providing behavioral health services and supports for them in the school environment. The absence from school affects students in myriad ways. In addition to learning loss, it compounds issues through the loss of many safety nets and coping mechanisms that schools provide, including a sense of support, stability, and routine. For students with behavioral health needs, school closures can mean that they no longer have access to the resources that schools provide. The impact of the pandemic on transportation, finances, and providers can leave families unable to maintain behavioral health appointments or medication compliance. And this places students in a vulnerable state, especially with the added stressors of a new school year, and it can lead to an increased risk for behavioral health problems or maladaptive coping behaviors, including substance abuse. The pandemic also affects the child's sense of security, which is completely dependent on the safety of their caregivers. Students may anticipate devastating events happening to them or to their loved ones, and they worry whether their parents or others that they know will contract or succumb to the virus. And some may have already experienced loss because of the virus. The sooner we can identify those who are showing signs of difficulties, the sooner they can be connected to support to prevent further academic and emotional decline. Stress was an epidemic for students even prior to COVID-19. A 2013 survey by the American Psychological Association found that stress among teenagers was extremely common. Of those surveyed, 83% said school was a significant or somewhat significant source of stress. A 2018 APA survey found that respondents aged 15 to 21 reported feeling high levels of stress regarding social and safety issues, including gun violence, school shootings, climate change, rising suicide rates, sexual harassment, and treatment of immigrants. Students are returning to school with increased stress related to the pandemic and how school closures and remote instruction affects their GPA and their academic achievement. The New York Times reported that at some schools, fewer than half of students participated in remote instruction during COVID-19 due to the lack of access to technology or reliable internet service. Students may be feeling loss, abandonment, fear, and they may feel abandoned due to the loss of in-person school attendance and the loss of staff and peer connection. As COVID-19 is still being researched and a vaccine has not yet been developed, students, parents, and staff have concerns about returning to school and how their potential exposure at school puts them and their family's health at risk. As I'm talking right now, I want you to think about this. How are you feeling right now when I talk about that, about the return to school? How does this feeling of stress regarding the return to school impact and affect students and staff? Stress and trauma can affect a student's academic performance, behavior in class, interpersonal relationships, and their physical and mental health. Understanding the impact of trauma by being trauma-informed means that when you're encountering difficulty with a student, the first thought goes to, how might this relate to trauma, rather than it being willful disobedience. Understanding how traumatic stress impacts the student does not excuse their behavior, but rather explains that. In addition to COVID-19, national events and media coverage of racism in communities has brought attention to issues of systemic racism and discrimination. Research shows that mental health is impacted by stressors related to racism and discrimination. And exposure to discrimination affects mental health, even early in life. Parental exposure to discrimination can adversely affect the child. Many students have also been monitoring national events and media coverage and could be experiencing additional stress in response. Every person experiences stress. When it's affecting a person's life, health, or well-being, or it's a high degree of stress, the goal is to prevent it as soon as possible, to address it to prevent deterioration. Awareness and recognition of stress responses provides school staff the ability to intervene and connect students to support prior to escalation and further decline. Children's responses to stressful events vary. Most children, when they receive the support that they need from their caregivers and other caring adults in their lives, will return to their previous level of functioning. Others are at an increased risk for developing mental health problems from trauma-related stress, anxiety, or depression. Psychological and physiological stress responses vary depending on a person's physical and mental health, personality, age, gender, past experiences, and other factors. Stressful events elicit a complex response in the body, primarily involving the autonomic nervous system and hypothalamic pituitary adrenal axis. It's also known as the HPA axis. Stress hormones such as cortisol and adrenaline affect the structure and function of the brain, especially when it's exposed to chronic stress. Untreated chronic stress can impact mental health and lead to depression, anxiety, self-harm behaviors, substance use, and thoughts of suicide and homicide. What is perceived as stressful to one person may not be stressful to another. For example, when parents tell their children that they're getting a divorce, some children may not be as impacted because they feel the tension in the house. And when their parents tell them that they're getting a divorce, it actually comes as a relief. Even in the same family, one child may react differently than the other. One may feel stress from the divorce, while another does not seem to be impacted. Lastly, stress is not always recognized. Think about a time when you had no stress. Maybe it was when you were on vacation. How was your energy level? How did you sleep? How was your patience? What did you eat? How did you eat? How did your body feel? We often grow so accustomed to stress that we don't even recognize it anymore. Some signs of stress in children can include impaired concentration or memory. They might be irritable, quick to anger. They may have decreased patience, or their mood may change. They may have increased anxiety or depression. We often see disproportionate reactions to triggers. So something that we would expect a small reaction, they may, for example, stub their toe on the couch and they end up having a complete meltdown. They may be overreacting. We may see a change in their appearance. They may be more disheveled, or their hygiene may be reduced. Boys may utilize deflection, denial, or detachment from their feelings when they're feeling stress. Or they may appear stoic, when in reality they're feeling high levels of stress. And because of COVID-19 and all the rules and restrictions, there may be an increase in anger responses from students to what they perceive are even more rules or restrictions that are in place. School staff are also returning with increased stress. Paying attention to how one manages stress and to know how and when to seek help for themselves or a student or a coworker is vital. So what are the stress indicators in adults? It could be a use or an increase in use of substances. It might be self-harm behaviors or a change in appearance. They may be more disheveled, no longer caring about how they appear. There may be increased conflict in personal or professional relationships, or a decreased work performance. For example, frequently late to work, leaving early, calling in sick, lashing out at students, or a decreased quality of their work. How can we mitigate stress in the classroom? We can incorporate movement, for example, working at stations, going outside. Fidgeting helps release feelings of anxiety and stress in some students and can help improve their focus. So fidget tools like cubes, chair bands, putty, or stress balls, or devices such as lap pads or disc seats can help with focusing and reducing feelings of anxiety or stress. Additionally, being consistent. So having the student know what to expect, and perhaps that's daily or weekly schedules. Especially when in a state of stress, our brains can sometimes shut down. So give them a break so that they can process new information. You can assist them with learning how to prioritize their task in order of importance. So examples might be providing assignments or instructions one task at a time, limiting homework when possible, consider working with other teachers to avoid scheduling tests on the same day, and encourage students when they're feeling overwhelmed to ask for help with prioritizing tasks, homework, or responsibility. This can really help with stress mitigation. Also teaching stress management and coping skills as tools. And these tools can be used to induce feelings of relaxation and to calm down. Help students to identify situations in which they can utilize these skills and praise them when they use them. Practice these skills often so that they know what to do when they're feeling overwhelmed, frustrated, or stressed, and it becomes a tool in their toolbox. Employing stress reduction activities in class, for example, deep breathing exercises, progressive muscle relaxation, or coloring are also helpful. One breathing exercise for stress relief that helps students learn how to take deep, calming breaths is to smell the flower, blow out the candle. We often hear that deep breathing helps to reduce stress, but how many of us actually try it? Deep breathing is one of the best ways to lower stress in the body because when you take deep breaths, it sends messages to your brain to relax, and your brain sends this message to the rest of your body, which reduces your heart rate and your blood pressure, and it relaxes your muscles. So I want you to practice this technique with me now. Everybody's at home. It's something that you can teach your students to use, or you can use it yourself to slow down and relax when feeling overwhelmed or stressed. So I want you to hold your left hand in a fist in front of you and imagine that you're holding a flower. In your right hand, I want you to make a fist and imagine that you're holding a candle. And I want you to deeply breathe in and smell the flower and blow out the candle. One more time. Ask the students what the flower smells like, what the candle looks like, what they're celebrating. These questions make the exercise feel more familiar to the student. And it may take a few times that you have to do this before you can visibly see the student relax and calm down. But for it to work, you actually have to feel the student feel the benefit of the breathing. As the child calms down, you can help them figure out why they got frustrated. And then you can work with them on understanding their frustration. And the next time that they have strong emotions, they have a tool that they can use. Because children are still learning what emotions are and how to control them. So it's important that we teach them different strategies for coping with the many emotions that they're feeling, especially in times of stress. Simply telling a child to calm down often makes them feel more frustrated, stressed, and misunderstood because it makes them feel like we don't care or that what they're feeling isn't important. When we look at trauma, we look at the traumatic event, the experience of the event, and the effect of the event. This means that not all stressful events involve trauma. Trauma is a reaction to a devastating event or events where a person is exposed to death, threatened death, actual or serious threatened serious injury, or certain forms of violence. And the reason for this narrow definition is that it is distinct from general stress, and traumatic events can result in prolonged responses that are unique from stress responses. And it also comes from a place of trying to protect the integrity of a diagnosis of trauma. An event can be traumatic when it is unexpected and perceived as being a threat to one's life or safety. And the more frightened a person feels during the event, and the longer that the event lasts, the more likely it is that they'll have trauma. Trauma can come from a single event, such as an assault, multiple events that occur over time, such as abuse, or it can happen cumulatively. Common sources of trauma include abuse, domestic violence, school violence, assaults, bullying, accidents, human-made disasters, and acts of terrorism. Every person will respond to trauma differently based on their exposure level to the event, their age, developmental level, their coping and resilience skills, support system, and prior experiences. Some will have no effects from the traumatic event. Some may experience immediate effects, and others may not show signs of trauma until some time has passed. Protective factors, including familial support, community support, and resiliency, can lessen the severity of the impact. For example, a child's caregiver who says things like, "We're doing everything we can to stay healthy, and if we get sick, we have doctors that can take care of us," and who remain calm and reassuring, can reduce the likelihood that a child will have trauma from the event. Minimizing the child's exposure to the news is also protecting or insulating them from the impact of the pandemic. And school staff can help students through reassurance about safety measures that are in place to keep students and staff healthy, and reminding them that they can help prevent the virus by washing their hands with soap and coughing or sneezing into their elbow, and by wearing a mask. Trauma can impair learning and school performance through inconsistent academic performance, decreased reading ability, lower GPAs, and increased risk for suspensions, expulsions, and withdrawal. Trauma can also impact executive functioning skills, including impulse control, decision-making, problem-solving, emotion regulation, and planning. So what does this look like at school? Trauma is particularly challenging for school staff to identify because students with trauma may exhibit unpredictable, impulsive, or aggressive behavior. Most children have occasional emotional outbursts, but if they're having repeated outbursts or they just can't control their tempers, it's very easy to jump to the conclusion that they're just defiant or angry children. But with trauma, disruptive behavior often stems from anxiety or frustration. They may exhibit poor self-regulation and difficulty with self-soothing. And one of the hallmark symptoms of trauma is hypervigilance, or being overly alert to danger. So students may have an exaggerated startle response or behave in a way that looks out of control or that mimics other disorders, including ADHD. Hypervigilance can lead to sleep difficulties and chronic irritability, and students with a high level of trauma may feel high levels of anxiety and frustration, which interferes with their attention, cognition, concentration, problem solving, and memory. They may also hear things said as a negative when it's said in a neutral tone. For example, if you say, "Please line up in the hallway," they may hear it as you angrily screaming it at them. Or they may be sensitive to making a mistake or being misunderstood, and it may appear as though they're being oppositional. So what are some takeaways for stress and trauma? Be prepared for the increase in stress and trauma. Over-communicate with parents, guardians, and students about the measures that are being taken to ensure the safety of students and staff. Include the protocols and responses that are in place if a student or staff member tests positive for COVID-19 or if there is a resurgence. Communicate in multiple formats, such as a letter home to parents, text messages, social media, email, phone calls, or auto dialer voice messages. This mitigates the risk for increased stress, panic, and fear, and it strengthens the relationship of trust between families, relationship and trust between families and schools. And regular communication will be critical. What can be done in the classroom or at school? What specifically can you do in your role to be more prepared for the increase in stress, both for you personally, for students, for coworkers, and for parents? Do you or your staff need additional professional development? Now is a great time to continue to learn and be proactive, just like what you're doing right now, to be better prepared for the new school year. Create time and a safe space for conversations as an entire staff. Perhaps this can take place during professional development or a staff meeting, or it can happen virtually. Carve this time and space to convey the importance of mental health awareness and crisis response by putting your money where your mouth is, actually having this time and space to have these difficult conversations. This is key to creating a knowledge shift and putting it into practice, because only then will it become part of the school culture. Be aware of staff member burnout, as it is preventable. Burnout occurs when a person gets to a point where they're no longer able to cope with excessive and prolonged stress levels. What changes can be made to reduce stress? Make time for personal interests and hobbies, because we don't make the best decisions when we're feeling sick, tired, or hungry. Self-care is conducive and critical for our mental wellness and our stress reduction. A trusted relationship with the educator and other school staff helps students feel safe and comfortable at school, and it's a foundation for their social development and future academic success. Avoid putting pressure on students to catch up from all the time that was missed from school in a short period of time, trying to get them to where they would have been had the pandemic not happened. Instead, focus on the students' capacity to learn by meeting them where they're at and helping them to get as far as they can. The pandemic has created an opportunity for us to reprioritize the investment in our students, especially those who are disconnected, vulnerable, and those who are high risk. The pandemic also highlighted the technological and digital divide in our schools and our communities. Think about the importance of trust in a relationship. How do you know if somebody cares about you? It's only in the context of a positive, trusted relationship that students are going to allow you into their world. And it can be challenging to connect with those students who are disengaged, acting out, those who have shut down or just given up. Building trust takes time, but the relationship between educator and student or staff member and student can have long-lasting and positive impacts on the student. A student who has a strong relationship with their teacher is more likely to be engaged in learning and achieve at high levels academically. They're also less likely to avoid going to school. Videos show teachers, coaches, school-based law enforcement officers creating special handshakes or saying daily positive affirmations, things like, I can do anything I set my mind to, I'm resilient, I'm important, I'm a good friend, I try my best. School-based law enforcement and school resource officers are a valuable resource at campus, building positive relationships with students and ensuring the safety and security of the educational environment. Students who feel strong connections to school staff will talk with them frequently because their interactions are positive and they receive constructive feedback and praise. Children and adolescents are keen observers of the behaviors of adults in their lives. They're looking to see if they can be trusted, if they keep their word, and whether they're genuine. Are your actions consistent? And are your actions consistent with what you profess? You say you care about me, but then when I come to talk to you, you don't look up from what you're doing. How do you create connection? It's by being present, showing interest in who they are, personal goals they have, actively listening to them, and avoiding multitasking while maintaining appropriate, healthy, professional boundaries of student and staff. So what are some takeaways from re-engaging? Prioritize relationships. Positive relationships between educator and student, student and student, parent and student, staff member and staff member, administrators and staff, and schools and parents are the foundation on which everything else is built. Ask how they're doing. Exercise and model patience. Be patient with yourself, with other staff. Give each other some grace. Incorporate examples that are inclusive and diverse and that reflect who students are, because this makes them feel like they belong and they're important. Giving students choices helps them feel like they have some power and control over what they do. Think about how we get a toddler to put on clothes. We give them a choice of this or that. So providing those fixed choices or those controlled choices gives them a sense of agency. But be sure you're willing to follow through on the choices that you give them. So for example, the choice between two topics to write about, the choice of group that they want to work in. Perhaps it's how they want to show their knowledge. So it could be book report, quiz, presentation, or activity. Another way that you can do this is through emotion regulation. Do you want to get a drink of water, or do you want to work on a puzzle for 3 minutes? Or for school-based law enforcement, would you like to walk and talk with me, or do you want to get a drink of water first? This is about halfway through the presentation, so I wanted to take just a minute to see if there's any questions. If there's not any questions so far, then I'll continue.
Great, thanks, Stephanie. We do have one question that popped in. Like many, our district has not made a definitive plan on returning fully, in part, or not at all. You discussed a lot about student-staff relationships, which I agree are key. What is your perspective on our ability to engage students in a social, emotional learning and positive relationship remotely versus on campus, but with major restrictions?
So I think that that's important. We did create a document that's on our website, on the Texas School Safety Center website, that has some ways to keep in contact with students, and I will get that link for you later. But yeah, it's absolutely key. So you're limited somewhat virtually versus in person, but maintaining those relationships is critical. So it can be through whatever source that you're using to implement that instruction. Other things, I'm trying to think of the examples that we have on that document, but it can be socially, right? Doing things together, writing a book together, and having all the students put in a paragraph that puts a book together. It could be doing there was one that was like a dance party, having a dance party together virtually, or writing a poem together virtually. And there's different examples that are on that document that I will connect with you after this. But the key is to maintain those consistent connections, and so that they feel comfortable coming and talking to you if there is something that's going on with them. But it is going to look different if it's virtually.
Great, thank you. I think that's all. We'll
Okay.
keep carrying on for now.
Amid the pandemic, with escalating tension and isolation, and an increased time spent online, an increase in cyberbullying, along with other forms of bullying and harassment, has been witnessed. And it would be negligent not to acknowledge that this behavior is likely going to transition to the classroom as school starts. With the increased use of technology, including for educational purposes, students who are prone to bullying are now more likely to cyberbully. Schools may have a harder time investigating it because of students being at home, so you can't talk to students about what they saw as easily. There may be also less oversight as parents are attempting to work from home and juggling additional responsibilities. And targets of and witnesses to cyberbullying may be hesitant to notify their parents because they're afraid of the repercussions, and they also don't want to burden their parents. They see that their parents are busy trying to either work or get a job because they were laid off, how to pay the bills, how to get groceries, and all those additional responsibilities. There may be some social challenges as students return to school, as many students may not have had social interactions in person or even perhaps online. In Texas, we have David's Law, which I know that we don't have just Texas here as an audience, but that was something that was created that now incorporates cyberbullying, and it gives schools more ability to have consequences for cyberbullying, and even cyberbullying that doesn't take place on campus, because obviously cyberbullying is online. So it can be anything that affects a student at school, even if it doesn't take place on school. And you can read more about that. You can just Google David's Law or David's Legacy Foundation. David's Law was named after David Molak, who is a 16-year-old student who died by suicide as a result of cyberbullying. Fear, anxiety, and misinformation about the virus can lead to stigma and bias towards people or places. For example, we hear news stories showing the expressions of hate language that's targeted towards Asians because they're assigning culpability for the virus and its aftermath on Asians. Xenophobia, where the fear or hatred of strangers or foreigners, and racism towards Asians, primarily those of Chinese descent, has increased since the beginning of the outbreak. Bullying behavior towards those who are or are not wearing masks has also been witnessed. Threats, taunts, or even coughing directly into somebody's face because they're wearing a mask has been witnessed, and it's an example of such behavior. Though we often talk about bullying as occurring between students, it can also take place between and towards staff and parents in your school community. Additionally, there may be a stigma and bullying behavior towards those who have had the virus, or those whose family has had the virus. Or even if somebody is just coughing or sneezing, they can have, they can be bullied because of that. Keep in mind that parents vary in their transparency with their children about current events, including that of COVID-19. And this can lead to varying degrees of knowledge within the student population. So students explain and respond to different events in various ways, including they're influenced by familial relationships, cultural traditions, religious beliefs, or the way that others in their life are reacting to things, including their parents or their teachers. In some families, masks may be seen as extremely important and not as important for another. Bullying is a devastating and serious problem among children and adolescents, and the impact can be long-lasting, as we know. Students who experience bullying, bias, and hate are more likely to feel unsafe, impacting school climate, academic performance, and school attendance. Psychological effects of bullying including depression, low self-esteem, anxiety, thoughts of suicide or homicide, and coping through self-harming behavior and substance use. Students with disabilities can be even more at risk because they may not have the capacity to understand what is happening to them or be able to appropriately report the behavior. Just a reminder about David's Law. So what are some takeaways? Nurture and encourage inclusivity and intervene immediately when there's conflict or hurtful exchanges. Encourage students to report if they're experiencing or witnessing bullying at school or online, including how to report that behavior. The language that we choose to use is important. So think about the term social distancing and what that implies versus the term physical distancing and what that implies. Language that is strengths-based focuses on the value that each student brings to the class rather than what they need to work on or what they lack. So diversity is viewed as a positive asset because it encourages inclusivity and it provides multiple perspectives. Appreciating diversity, it builds empathy and tolerance, and it discourages bullying, bias, and hate. Also foster kindness, compassion, empathy, and tolerance among students and staff. Empathy helps us become observant of how others may feel, take the perspective of others, and resolve conflicts positively. Provide additional support for those who need accountability or those who need encouragement. Know what your school or district's community resources are, for example, mental health resources or food pantries. Allow for some frustration and irritability because we're all going through a lot of change in a short amount of time. Assist students with adapting to change and finding appropriate ways of coping. Encourage physical activity and brain breaks because this helps support physical and mental health. And teach and practice self-care strategies, including healthy eating, getting enough sleep, and taking a lot of breaks when we need them. With the additional stressors and the impact that COVID-19 has had on students, knowing the signs and symptoms of a mental health condition is critical so that we can connect students earlier to treatment and to mitigate symptom progression. Schools play a key role in identifying the early warning signs of a mental health condition and in linking those students to effective supports and services. Behavioral health is a blanket term that includes mental health and how someone's behavior impacts their physical and their mental health. Mental health and mental illness are more specific terms. Mental health is not just an absence of illness. It includes how a person feels, thinks, and acts, and it encompasses our emotional, psychological, and our social well-being. It helps to determine how we handle stress, how we relate to others, how we make choices, and how we function on a daily basis. The American Psychiatric Association defines mental illnesses as health conditions involving changes in emotion, thinking, or behavior, or a combination of these, and they're associated with distress, problems in functioning in social, work, or family activities. Mental illness is prevalent. 1 in 5 adults and 1 in 5 children experiences a mental illness. Unfortunately, many of these children don't receive the treatment that they need, mostly due to the stigma that surrounds mental illness. Cultural beliefs and practices can also impact a person's view towards mental illness and treatment. Without treatment, specifically early treatment, outcomes can be devastating. Untreated children are twice as likely to abuse drugs and alcohol. 50% of untreated children will drop out of high school, and rates of incarceration and risk for suicide also increase. So the CDC released data recently that showed that 1/3 of Americans are showing signs of clinical anxiety or depression related to the pandemic. But that was just updated recently, and they're saying almost 50%. Hurricane Harvey aftermath and its aftermath showed that nearly 1/3 of the respondents experienced mental health problems. So these traumatic events that are experienced can put individuals at a risk for mental health problems, especially children and those previously exposed to trauma. And it takes, on average, 8 to 10 years for somebody to start to display warning signs of a mental illness until the time that they get treatment. So think about the deterioration that can take place in that time, 8 to 10 years. So how do you know if what you're seeing is typical behavior or something more concerning? School staff and parents are positioned to notice the warning signs first, as they spend the most time with children and can identify when moods and behaviors and their patterns shift. Normal development and personality changes in adolescence can sometimes mask the symptoms of mental illness. When looking at typical and atypical behavior, one must look at the age and the developmental level of the child and also whether they have any developmental or other disabilities. For example, a 2-year-old throwing themselves on the floor is relatively age and developmentally appropriate behavior. However, a 17-year-old doing the same is not age appropriate, but it may be developmentally appropriate depending on what else is going on. Young children do not know how to accurately label their emotions because their vocabulary is still developing. So their symptoms can manifest as physical complaints because they're not able to verbalize, I don't want to go to school because Alex keeps picking on me, and I'm sad because I don't have any friends. They may say instead things like, my stomach hurts, my back hurts, or I don't feel good when they're asked why they don't want to do something. They may also express their feelings through their behaviors, and as such, it's often necessary to look at young children's behavior as an indicator for their mental wellness. Adolescents and young adults, on the other hand, they're often oversensitive, they're often self-conscious, and they don't yet have the coping skills that are needed to deal with all the problems that they have growing up in today's world. Parents and educators will often notice periods of sadness, anger, frustration, and anxiety with adolescents. However, this should only last a couple of days. Typical worry or anxiety may be expressed through anger and defiance in adolescents, and they may alter their appearance to look intimidating or to keep others from getting too close to them. And they may use illicit drugs to seek relief from anxiety, fear, or depression. So what are the warning signs? I'm using the term warning signs because it's not predictive. These signs are not predictive of them having a mental illness, but it could indicate that they're exhibiting the symptoms of an onset of mental illness, or that they may be experiencing a difficult time. So they may be going through bullying or abuse, neglect, trauma, or grief. So you want to look at warning signs as a whole and whether they're causing changes in the student's ability to study, work, or relate to others. Warning signs are varied and individual. So this requires that the typical behavior and mood for that person is known, because really anything can be a warning sign. And so if I say withdrawn, well, if a student is a little bit more shy and withdrawn and that's their personality, that's not a warning sign. Versus a student who is normally outgoing and friendly and all of a sudden they're becoming more withdrawn, that can be a warning sign. So it requires that you recognize what their typical behavior and mood is, and that any changes or deviation in that is noticed and followed up on. So this is especially true for students, and it emphasizes the importance of that relationship that I talked about earlier. Warning signs are often exhibited through changes in mood, behavior, school, or thoughts. So some mood changes that you might notice are overwhelming sadness, anxiety, worry, anhedonia, which is no longer enjoying the things that they used to enjoy. So for example, if you have a child or a student who loves basketball, actually, I'll tell you a story. A close friend of mine is a school-based law enforcement officer, and his son had loved football. And all of a sudden he doesn't want to play football anymore. And he's in 6th grade, and he called me and he said, I don't know whether I need to force him. I think he was in 7th grade. I don't know whether I need to force him to continue to play football, or whether I should, obey his wishes not to play football anymore. So he's noticing that this is a change for his son. He's always liked football, and now he doesn't want to play football anymore. It could be apathy, extreme moods, or mood swings. Behavior changes are typically what we notice first. In students, in children, actually with anybody, adults too, we typically notice behavior changes first. So some warning signs for behavior might include withdrawing from family or friends, which is not age appropriate. And I say not age appropriate because there is a period in adolescence where, and it's a healthy stage for adolescents to withdraw from their family as they seek to identify themselves as an independent person apart from their parents. And so they'll spend more time with friends. So if they're withdrawing from their family and their friends, that can be a warning sign. There may be decreased hygiene, increased aggression, talking about suicide or homicide, increased impulsivity or hyperactivity that's not age appropriate. So young children are going to be impulsive and hyperactive, for example. You may notice a drastic change in their personality. They may utilize non-suicidal self-injury, otherwise known as cutting, or increase in use or use of substances. Changes in thoughts may include a change in ability to make decisions, a change in concentration, or maybe they're no longer able to problem solve. And another change that you might notice is if they're hearing voices. And when I say hearing voices, I mean they're hearing them externally, like you're hearing my voice speaking with you, not their conscience or their thoughts. School changes may include a sudden decline in grades, a loss of interest in friends or extracurricular activities. If they're refusing to go to school or resistant to go to school, or you're noticing more behavior problems in school. The number of children and adolescents in the United States who were admitted to a children's mental health hospital for thoughts of suicide or self-harm more than doubled between the years 2008 and 2015. With suicide being the second most common cause of death for children aged 10 to 24, it's important to know the risk factors and how to get help for students. According to the National Alliance on Mental Illness, otherwise known as NAMI, 90% of people who died by suicide had signs of a mental illness at the time of their death. However, these disorders had not been recognized, diagnosed, or adequately treated. This means that if we can recognize the warning signs of mental illness and the warning signs for suicide, and we get these people connected to help, we can actually potentially save lives. With the economic hardships, fear, and uncertainty of the COVID-19 pandemic, and as people feel hopeless, suicide rates could increase. It's important to pay attention with students, but also pay attention to your coworkers, peers, and loved ones. If you notice that they're struggling or having a difficult time, reach out to them, provide support and encouragement, and provide resources if needed. We hear on the news or after a devastating event, just ask for help. If you're going through a hard time, ask for help. If you are extremely depressed, stressed, anxious, it's very difficult to reach out for help. And when you do reach out for help, it may be misunderstood. So that's why I say it's on you. If you notice somebody is struggling, it's on you to reach out to them and to try to offer help rather than wait for them to ask for help. Suicide cuts across all demographic lines. People of all ages, ethnicities, and genders can be at risk. Suicide rates have actually grown in the geriatric population as loneliness and health problems become more prevalent. So relationship problems, substance use, and job or financial problems are some of the other circumstances or situations which can contribute to suicide. Individuals aged 55 to 64 saw the greatest increase of any age group since 2000. Sorry, that's my dog snoring if you can hear that. If a student expresses a desire to harm or kill themselves or others, it's important to take that seriously and not minimize or dismiss their behaviors or their statements as attention-seeking. Never promise confidentiality. One of the ways that I teach people how to still talk with students but never promise confidentiality is if a student comes to you and says, I want to tell you something, but you have to promise not to tell anyone. I tell them, the adult to say, I can't promise you that because I don't know what you're going to tell me. And if you tell me that you're going to hurt yourself or hurt somebody else, or if it's another situation where I feel like I need to tell somebody, then because I care about you, I can't promise that I'm not going to tell anybody. Suicide contagion is real. It's not contagious like a virus is contagious, but how we talk about suicide or how we talk about somebody who has died by suicide can increase or decrease the risk of that continuing. And you can research about, there's media talking points and ways to talk about suicide to minimize this risk. What are the warning signs for suicide? If you hear somebody feeling like a burden or talking about being a burden, for example, my mom has too much going on without worrying about me. All I do is make her life hard. Feeling hopelessness, and this is the biggest warning sign for suicide, is the feeling of or expressing hopelessness. So things like things will never get better, things are never going to change, it's too late now, I'll never be happy again. Feeling trapped, so there's no way out of this. Feeling helplessness, or expressing things like, there's nothing that I can do to make this better, nobody can help me. Thoughts about or plans for death, including giving away prized possessions. So things like, if anything happens to me, I want you to have my Xbox, or whatever the new most popular thing is right now. It could be talking about a desire to die, but making statements or comments is a way of asking for help, sometimes as a last bid effort. So all talk of suicide should be taken seriously. Suicidal thoughts or actions are a sign of extreme distress. Even if the student does not desire to die by suicide and they're just making a threat to get attention, it still indicates a need for additional support. There is going to be an increased need for mental health support. So what resources do you have? In addition to school counselors, school psychologists, and other school-based mental health professionals, there's community providers, community agencies, and in Texas, school resource officers and school-based law enforcement have or will have some mental health training and may be able to help with de-escalation. Encourage staff to take care of their mental health and seeking support through their employee assistance program or through their health insurance, and creating policies that destigmatize mental illness and encouraging time to take care of their mental health are also very important. One of the biggest things that you can do that I think is so important and isn't talked about as often is to ask and mean when you ask, how are you? And really asking and touching base with people to see how they're doing. Letting them know that you're not alone. Destigmatizing mental illness by recognizing the importance and that mental health should be prioritized equally to physical health, and also knowing that when we take care of our physical and mental health and going to those preventative care appointments actually increases work productivity, decreases absenteeism, and it optimizes the health and safety of the employee and the school. Spend time getting to know students, listen and allow emotional expression. But abuse, neglect, domestic violence, or trafficking may have occurred at home. And there is some startling statistics that when students were pulled out of school and they're doing remote learning and they're online more, it's occurring at an even higher rate than it was before. And in Texas, trafficking is defined as a form of abuse or neglect. Students are more susceptible to becoming targets of trafficking as a result of the consequences of the pandemic, including financial insecurity, financial instability, homelessness, lack of resources, increase of substance use, lack of medical or behavioral health care. And as students have increased stress levels and all of the other things that happen as a result of the pandemic, and they're not able to spend as much time with their friends and other peers and students and spending more time online, this makes them even more vulnerable. So if you suspect abuse or neglect, mandated reporters in Texas are required to call the Texas Department of Family and Protective Services. In Texas, you cannot delegate this to somebody else or assume somebody else is reporting. So if you suspect or a student told you, you are the one that needs to report. The best choice is to always err on the side of caution and have a mental health professional determine intent and risk level. Determining risk level, intent, and referral to a community mental health provider is done here, at least in Texas, through a school-employed mental health provider, community mental health provider, or our district's safe and supportive school program, because they've been trained in how to conduct behavioral threat assessments. But follow your district's protocol. I also wanted to mention a great resource to have. I encourage people to have this phone number programmed into their phone, and it's the National Suicide Prevention Lifeline. It's 24/7, and it offers free and confidential support for those who are in distress, and it also provides prevention and crisis resources and best practices for professionals. And they want you to reach out to them even if you're not suicidal. And it can be a child, it can be an adult. You got laid off from your job, you're breaking up in a relationship, you're overwhelmed, you don't know what else to do. This is a good number to reach out to. And it's 1-800-273-8255, but you can just Google the National Suicide Prevention Lifeline. And one of the best ways to support students and staff in the transition back to school is through nurturing and developing resiliency. Every person will experience tragedy, serious health problems, the death of a loved one, or other stressful events. Those who adapt well during adversity, or those who are having less difficulty weathering stressful or traumatic events such as COVID-19 are those who are resilient. One of the ways to nurture resiliency is by encouraging a growth mindset in students and in ourselves. So if you're not familiar with this, Dr. Carol Dweck and her colleagues researched students' beliefs and attitudes towards failure. Her research found that students had one of two types of mindsets, either a growth mindset or fixed mindset regarding learning and intelligence. A person with a fixed mindset believes that a lot of things, but for example, intelligence and ability are innate abilities, so they cannot change, they're fixed. A person with a growth mindset believes that their intelligence and their ability can grow with experience and effort. So a student's mindset can be observed from how they behave and react to failure. A student with a fixed mindset will do everything possible to avoid failure because they perceive failure as a reflection of their abilities and their intelligence. And if they appear unintelligent or if they fail at something, there's no recovery from that because they can't improve. So they may make excuses for things, or they may say things like they're unable to learn math, or I failed at that because my teacher's a bad teacher. A student with a growth mindset views failure as a learning experience and believes that with effort, they can use failure as a way to improve. These students tend to take on challenges and learn from them, which consequently increases their ability and their achievement. One of the ways to encourage a growth mindset is to never praise somebody based on how smart they are. So focus on the effort and the perseverance they put into something. So if they made 100 on a test, wow, you studied really hard for that test. Or they tried out for the track meet. Wow, you really worked hard to get on the track team to do well in the track meet. Because the good and the bad news is that neither mindset is permanent. So a fixed mindset can be nurtured and a growth mindset can be nurtured. And this image shows how a growth mindset actually drives motivation and achievement. When the mindset is, I can get smarter, therefore learning is my goal, effort makes me stronger, I spend more time and work harder, and therefore I achieve higher things. Resiliency can be developed in an individual, and it involves thoughts and behaviors that can be learned and improved upon. Other skills that are helpful and that can be included in a school setting are things like not dwelling on a failure. Acknowledge the situation, learn from your mistakes, and move on. Thomas Edison famously said, I did not fail, I just found 10,000 ways that won't work. I think these kind of resiliency skills are really helpful for students who have made life mistakes as well, not just academic mistakes. So for example, I worked a lot with adolescents on probation, and they had a really hard time with learning how to move past. And so recognizing that you just have to keep trying. It doesn't mean that you're a failure because this one thing happened. We just have to keep trying until we're successful. So it's not just about failing on a test. It can be life events as well. Failure is not a state of being. It is a one-time event. Gratitude, identifying those people or things or situations to be thankful for or grateful for is a resiliency skill. Finding the humor in a situation, because laughing can make things easier to digest, and it lightens up what can be sometimes daunting and overwhelming. Focusing on a long-term perspective or looking at it from a long-term perspective. So I actually use this one a lot. So whatever you're going through, it may not be a minor thing. So for example, experiencing a breakup of a relationship. That is not a small thing. It's acknowledging that it's painful, it's stressful. It's not something minor to just get over. But if you think about it from being 85 years old and looking back on your life, will this experience be as painful or as big of a deal as it is now? And no, when you look at it from 85 years old and looking backwards, it's not. Another one is viewing difficulty as a challenge to overcome. So saying things like, I've always figured out a way to meet any challenge, and I will figure this out too. Another skill is only focusing on what you do have control over rather than what you don't, and avoiding those stressful things that you don't have any control over. So for example, regarding the pandemic, instead of all the areas we can't control, what I did to help me get through it and what I did to keep me safe. This would be a great writing exercise in class. So focusing on what you did do to keep safe. Helping students, staff, and parents recognizing that whatever they have gone through with regarding the pandemic maybe has helped them realize that they're stronger than they ever thought they were. Then they've been able to cope with all the change that has occurred through the pandemic. They may have reassessed their priorities, found new hobbies, new skills, or a new appreciation for life. Maybe they developed a different outlook as a result. Sometimes just recognizing what we've not only endured, but survived and even perhaps thrived in is a great resiliency skill. And I want to thank you. Thank you for caring for and supporting the academic, social, emotional, and mental health needs of students. Focus on re-engagement, strengthening the relationship between school staff and students, and nurturing resiliency. Because students are best supported in the transition back to school through you and the important role that you play, which means that your self-care is critical. Our website is txssc.texasstate.edu. We have a ton of resources on our website. This is my contact information. And that concludes my presentation, and I would love to answer any questions you may have. Please enter them into the chat box, and I will answer as many as I have time for. Thank you.
Thank you so much, Stephanie. We have a few questions. I know that we're running close to the end of time, so I'm going to just kind of read a couple out, and we'll see if we can answer some. What are examples of best practices for developing parent-teacher partnerships in supporting increased student engagement?
I don't know the answer to that question. I can look into that and get back to you on that one.
Okay. Another one is, how can we monitor students' well-being when they don't join any remote learning, students who we've not seen at all during this time?
So that is one that you're going to have to start from when they start back into school and really intentionally reaching out to them. If they're not engaging in any remote learning, there are other, and actually let me pull this up for you, that one resource that I have. Okay, so the document that we have created is on our website under, I'm going to copy this and paste it into the chat here. Okay, so it's under COVID-19 FAQs, Resources for Schools, How to Stay Connected to Students, and it's called How to Stay Connected with Students in a Time of Disconnection. And we also have one specifically for school-based law enforcement. So it's almost like an MTSS system, but it's, if you can't reach them via virtual learning, how else can you reach out to them? And it maybe when school comes back into session, that teachers are able to do that in their everyday when they're reaching out to them via remote instruction. And then if you can't reach those students, or they're kind of higher on the tier, is there other people that can reach out to them? And it may be going to their home. It may be through mailing a letter. It may be calling them and trying to reach out to them in that way. And then the ones that are even, further down the line, what can be done there? And it may be reaching out to those students, but on a more regular basis. And I will pull up the link to put that in there too for you guys.
Great. Sorry, my microphone kept getting muted. I think I have time for one more question that I want to just ask you, if I can get to it. And when addressing reopening plans, what kind of strategies can schools implement to enable factors in children to help them buffer COVID-19 related trauma when school does resume?
Well, some of the things that I had mentioned to kind of help minimize and buffer, careful how we talk about things. One of the things that is brought up a lot is, PPE and wearing masks and what the purpose of behind the masks. Sorry, let me we have bad allergies here in Texas. So approaching the conversation with children about masks, for instance, with empathy, because it's a change in what they're used to. It's understandable that people are feeling anxious right now. and letting them know what safety measures are in place and what we're doing, what your plan are, and what the tools that you're implementing to keep them and their teachers and their families safe, reminding them about what they do have control over. So wearing masks, coughing into their, their elbow or into their mask, washing their hands with soap and water, those things. Other things that can be done is recognizing that those people who aren't wearing a mask, it may be because of other reasons. So not targeting them, or like, for instance, I had a question about if a teacher is wearing a mask and students are scared because the teacher is wearing a mask. So explaining that we do that to protect other people. It doesn't mean that necessarily she is sick. So just being proactive. What are your policies that are in place? What are your plans that are in place? Careful of the language that we use, and just kind of being aware of those things, and that things will unfold in time. So students will let you know in time, or you'll be able to experience that in time, whether they've had any trauma and what's going on, but just those things that you can do ahead of time to be proactive and educating yourself and your staff on those things.
Great. Well, thank you so much for your time. We're a little bit over, so thank you everyone for staying engaged. We really appreciate the conversation. I think a lot of people seem to be really engaged in this, so it's a excellent job. And thank you, everyone. Again, we have one more session for the Forum for Student Mental Health, which is going to be on August 5th. Please reach out to me if you would like and have not already been registered. Otherwise, I hope everyone has a great rest of their day.